The presence of an epinuclear cushion means safety while you are phacoemulsifying the hard nucleus in the bag. Do not relax after the nucleotomy. Withdraw the probe into the anterior chamber and the epinuclear edge collapses. Engage the epinuclear edge and bring it to the center away from the posterior capsule. The last bit is taken in about the pupillary plane so that a good distance is maintained from the posterior capsule. Beware of the surge here because the posterior capsule is unprotected now. Lower your settings. Otherwise, you can engage the epinuclear edge and bring it to the center and release it above the iris plane and push into the fornix of the epinucleus, bringing it down and then engaging the edge again and bringing it above the pupillary plane and aspirating it away from the posterior capsule. The edge is being pulled, drawn towards the center, then the probe pushed into the fornices so that it comes down, and then the whole epinuclear plate is brought out of the bag and aspirated above the pupillary plane safely. Epinucleus to us doesn't mean an epinuclear cushion only. The cortex is also epinucleus. Use a second instrument to bring the epinuclear plate down while the edge has been engaged in the phaco-tip. Bring it away from the posterior capsule above the pupillary plane and remove. Use the chopper to bring it out of the bag once it is engaged in the phaco-tip. The settings have to be low and aspiration has to be slow. Prevent any surge. To increase safety, some amount of the epinucleus which is adherent to the posterior capsule might be removed by IA also. If the pupil is small, you might not be able to see the edge of the epinuclear plate or the rhexis margin. You push the iris away with a chopper to expose the margins and release once you have engaged the epinuclear edge. Bring it to the center and remove it at the pupillary or above the pupillary plane. Push with a chopper the pupillary margin away so that you can visualize the epinuclear edge and engage under direct vision. If the pupil is small, the bore and the flow rate of the phaco probe can be dangerous. Never go blindly. The epinuclear edge and the phaco tip should be visible. So you use an IA probe first. Engage the edge with medium vacuum and bring it to the center. Release it above the pupillary plane and inject viscoelastic to bring epinuclear plate away from the posterior capsule. Now you can go in and remove the epinucleus with a phaco probe at the pupillary plane or above safely. You can see the epinuclear edge has been brought to the center with the IA probe. Viscoelastic injected behind to bring the epinuclear plate away, and now it is being tackled by the phaco probe. The second instrument slowly bringing out the epinuclear plate out of the bag and feeding it into the phaco probe. Since the PC is unprotected now, don't take any chances. When needed, use the IA probe. So epinucleotomy, like nucleotomy or any other step during phaco surgery, needs unfaltering focus. Do not relax after the nucleotomy.